Hi, and welcome to Social Work 101. I hope my presentation today can answer some of your questions about the field of social work and can help you decide if you may be interested in pursuing a job in the field. So let's just get started. What is a social worker and what do they do? So a social worker is someone who provides personal welfare services to people who are in need. People who are in need could be poor people, physically or mentally disabled people, elderly, children, students, delinquents, and criminals. So pretty much anybody within our society may qualify as a person in need at one point or another. Their job as a social worker is to help the people who are in need cope with life's challenges and adjust to changes. Some of these challenges may include illness, divorce, unemployment, adoption, incarceration, and a variety of other things that may happen in life that may create a need for you. So a social worker's duties are pretty broad. So as an advocate for their client, social workers' jobs are to identify and assess their client's needs and strengths, to help them develop a plan to improve their situation or to improve their well-being. Social workers are critical in aiding clients in receiving the benefits that they qualify for and just putting them in contact with the resources that they may need. They counsel and advise their clients as well as respond in times of crisis, and as an advocate for the well-being of their clients, they just follow up with them periodically and just overall provide support in any way that they can. So as you can imagine, in this field, there's a broad area of need. And so there are many different areas of specializations within the field of social work. And they range from healthcare and clinical social work to child and family social work, school social work, hospice and geriatric social work, medical social work, mental health and substance abuse, as well as criminal social work. And so, as varied as the specializations in the field are, you can imagine that the work settings in social work are also extremely diverse. Social workers can be found working in hospitals, working in substance abuse clinics, working on school and college campuses, working in private practices, mental health clinics, state and local governments, nursing homes, correctional facilities, and child welfare agencies. So social workers are pretty much across the board working in a variety of different settings. The nature of a social worker, the nature of the job is highly demanding. Oftentimes, the people who are in need can sometimes prove to be difficult or challenging clients, and so that can be very demanding on a social worker's time. Usually their time at work is spent between an office setting where they're doing office work, paperwork, and kind of following up, scheduling appointments, and traveling, which includes visiting with clients, traveling to meet them in their homes or at various locations. The field of social work is highly understaffed. It is a demanding job that oftentimes can result in a shortage of employees. Social workers, because of this shortage, often carry large caseloads. It is a full-time job, and they oftentimes will have to work on evening and weekends in the event that a visitation with the client is necessary in one of those times. So to become a social worker, there are certain education goals that you have to meet first. For entry-level positions, a bachelor's degree is most always required. Now, you can have that bachelor's degree in social work, but depending on the employer and depending on the specific specialization of the job, some employers may accept a bachelor's degree in a related field, such as sociology or psychology. Now, in certain specializations of the field, such as clinical social work or health care social work, a master's degree in social work is required, and as well as sometimes 2 years of clinical experience before you could be hired in one of those positions. If you are interested in being a social worker, sometimes it's best to reflect on your own personal qualities and decide if you have the kind of qualities it takes to make a good social worker. Some of the desirable qualities for the field include compassion, interpersonal skills, listening skills, organizational skills, problem-solving skills, time management skills. So you really just have to be someone who's really great at working with people, who has a compassion, and who feels motivated about helping people in need, as well as being organized and able to manage your time wisely. So the median income for a social worker in the United States is $44,200. So what that means is that 50% of social workers earn more than $44,200, and 50% of social workers in the United States earn less than $44,200. In the field, the top 10% of earners in social work earn more than $72,000 a year, with the bottom 10% earning less than $27,000 a year. So although $44,000 a year doesn't seem like great compensation based upon the amount of time invested in the job, it is actually still almost $10,000 per year higher than the median income for all occupations in the United States. For all occupations in the U.S., the median income is $34,720. So that puts the median income for social workers, which is $44,200, at about $10,000 higher. So that is something positive about their wages. The job outlook in the field of social work is very strong. As I mentioned before, it's a job in high demand, and they're very understaffed. Currently, there are 607,000 social work jobs in the United States, and they are projected to grow at about 19% in the next 10 years. And that is considerably higher than the rate of growth for all jobs total, which is only about 11% projected growth. So with that 19%, that is projected for 114,000 new jobs to be created before the year 2022. So if you move on to the next slide, I've created an employee profile. And so what this profile just does is I took an employer who is someone who employs social workers, and we just kind of break it down to give you an example of a real life setting in which a social worker might work. So the employer that I've chosen is the Baptist Health System Foundation, and they're out of Jacksonville, Florida. And the Baptist Health System is a system of healthcare facilities that includes hospitals, clinics, geriatric facilities, pediatric facilities, and they kind of are, one of their missions is to serve families in all areas of life. They are faith-based, mission-driven, locally governed, and community-focused. The Baptist Health System has a vision of social responsibility. They see healthcare as their social responsibility, and they seek to fulfill that. Some of their goals are that all babies may start out healthy and strong, that families in need will have the access to quality, affordable healthcare, and that elderly people will be able to live fulfilling and independent lives for as long as possible. The Baptist Health System employs over 8,000 individuals in the area. That makes it the area of Jacksonville's largest private employer. The behavioral health sector, which is a specific sector of the Baptist Health System aimed at behavioral health, employs 25 behavioral health specialists. That includes 2 clinical social workers as well as 3 licensed mental health counselors. So the Baptist Health System was recently in the Florida Times-Union. The Florida Times-Union was highlighting the Age Well program, which is it's a division of the Baptist Health System. The Age Well program is really aimed at helping seniors maintain a high quality of living for as long as possible. So the Florida Times-Union mentioned that in their article, oftentimes as a senior, you may have and be dealing with medical problems and taking medications that you might not fully understand. And you might not fully understand the ramifications of medical issues you may be dealing with. So as part of the Age Well program, you are assigned not only a primary team of physicians, but also a team of social workers and other people who can help the seniors make more sense of what's going on, and to help them find ways to live independently and really just make the most of their remaining years. The Age Well program has reported many positive outcomes, and there are many people in the Jacksonville area that have been extremely satisfied with the program. So we're going to move along to a hot topic in the field of social work. And if you've ever discussed going into the field of social work with anyone, you may have heard someone tell you that it is a high stress job. Once someone told me, all they said was, don't do it, because they had been a social worker previously for several years, and the demands of the job were very high. In 2004, there was a national benchmark study of licensed social workers that reported a critical shortage of licensed social workers. So in 2007, the National Association of Social Workers, they wanted to make sense of this. They wanted to figure out what factors in the field were influencing such a shortage of social workers. And so what they found is many different factors that contribute to the stress that social workers experience at work. Some of these stressors include insufficient time to complete tasks, a heavy workload, poor compensation, challenging and difficult clients, unclear expectations, few resources, and long hours. So all of that sounds pretty daunting. Some of these stressors, what they can ultimately lead to, if not alleviated, is increased risk for injury, impaired performance, poor mental health, impaired cognitive function, decreased concentration, health-related problems, and ultimately to burnout in the field, which is what the benchmark survey mentioned. The report by the National Association of Social Workers reported that 31% of surveyed social workers said they had not enough time to complete their tasks. 25% said that heavy workloads contributed to stress. 70% of social workers in a healthcare setting reported fatigue due to work stress, and 25% of child welfare and family social workers reported sleep disorders due to work stress. Looking at the positive that the National Association of Social Workers gained from the survey was that over 72% of social workers surveyed said that exercise was extremely effective at alleviating some of those work stresses, and 30% of social workers said that meditation was helpful in alleviating some work stress. So I hope you have enjoyed my presentation on social work today. I hope that you have learned something new, and maybe, like me, you will find yourself interested in pursuing a field where you can help people throughout our country, people in need and people who need you.